Appreciate each of you being here today.
Okay.
So if you'll state your name, your affiliation, your position on the bill.
My name is Dr. Kevin Finkel. I'm testifying based on my professional and personal experience as an individual, and it's based on my current position. So I'm currently...
And your position on the bill, you're testifying?
I'm testifying for it.
For the bill, okay, thank you.
So I'm currently a tenured professor of medicine and director of the kidney disease section at the UT Medical School, McGovern Medical School in Houston. So taking care of kidney failure patients, I take care of one of the most complex patient populations. They all have heart disease, they all have diabetes, they all have vascular disease. They have about on average, four different physicians taking care of them, and they're on an average of 10 medications. So first of all, I want to say there is no such thing as a safe medication. Everything has a side effect, and some of them can even be life-threatening. So when I'm taking care of a patient, I always have to think about the risks and benefits of any drug, and that's what you discuss. And so if I make a decision that this drug has more benefit than risk, that's what we enter into as a part of their therapeutic agreement. And in fact, I would look at it a different way. Sometimes it's more risky not to take the drug than to take the drug. So that's my patient, and here's what happens. So a commercial comes on, a person's in a white coat with a fake stethoscope. There's a logo behind, maybe the FDA, and all they talk about is the horrible things that can happen if you take this medication. Not taking into account that the doctor may already know that there are potential side effects to the medication and that they counseled the patient about it, that some drugs just have a narrow therapeutic index. And what happens is it totally makes the patient get scared. And they target the most vulnerable people. They're the elderly. They're my mother. They're the elderly. They got multiple different medical problems. And what unfortunately some of them do is they stop the medicine. And again, sometimes not taking the medicine is more risky than taking the medicine. And so the first time the doctor finds out about it is when they're in their office with their blood pressure out of control, or they've lost kidney function. Or they're in the emergency room because their blood pressure is out of control and they've just had a stroke or a heart attack, or in some cases with blood thinners, they've actually died. Blood thinners make you bleed. That's how they work. They also keep you from not having strokes, right? So the way the current advertisement goes, it accomplishes four things. It scares vulnerable people. It increases their risk of harm because having a commercial tell you to possibly stop a drug that's practicing medicine without a license as far as I'm concerned. Number three, if they're in my office more often or I'm sending them to the emergency room or they're having a heart attack, you're increasing health costs. And fourth, it completely destroys doctor-patient relationship. Because when I bring them back to my office and I say, no, you really need to be on this drug, they say to me, are you sure, doc? What they're really saying is, do you know what you're doing? And it completely destroys any trust we have. And I've had patients who refuse to go back on the drugs. Okay, so that's my professional experience. My personal experience is my mom's an 83-year-old widow from New Jersey, moved to Fort Worth, and now has moved to Houston, and I'm an only child. So I spend 3 or 4 days a week with her watching the typical channels that an 83-year-old woman from New Jersey watches. Judge Judy, and the shows that like Password and whatnot. And on those channels, every third commercial is one of the ones like you saw. And my mom's on a lot of those medicines, and her response is, do I need to come off of this? Aunt Marilyn's on this. And my response is, no, this is not real information. You can ignore it. But I mean, so to me, there's no benefit to patients. I'm kind of offended by people saying, well, some of these drugs are just really dangerous. Okay. And the only other thing I would also say is this: people have been bringing up about the regulation of the drug consumer things, which I'm not in favor of. But the important point is they can come to the doctor and say, should I be on this? And I can say, no. We're not talking about, they can't get it without a prescription. We're talking about people who have been prescribed a medication by their physician, and a commercial can actually make them change what they're doing. And for that reason, I fully support the bill.
That's great testimony. Thank you. Vice Chair, final witness on this bill, Lee Parsley, Texans for Lawsuit Reform. If you'll go ahead.
Good afternoon, Chairman Leach, members of the committee. Lee Parsley on behalf of Texans for Lawsuit Reform. I'm here on behalf of House Bill 2251. I have enjoyed the testimony by this panel that I'm with. I want to focus on a different aspect of the bill. Many of the TV advertisements you see on television are run by what we would refer to as client harvesters. These are both lawyers and non-lawyers who are advertising for clients who they will then sell essentially to other lawyers to prosecute the case. These advertisers many times have no intention of representing the client. They just don't. They are merely harvesting clients which they, in bulk, sell to other lawyers, and they take a percentage of the fee. I will tell you that we find that process somewhat distasteful just to begin with, but it's not unlawful today. But we do think that if you are advertising on television and you don't intend to represent the client, your advertisement should say so. Your advertisement should tell the public, you're not hiring me, you're hiring someone else. I think when you hire a lawyer, the critical decision you make is, who is the lawyer? No one ever hired Lee Parsley to have Lee Parsley farm out their case to some other human being. They just don't hire me to have me just pass it off to someone they've never heard of before. People hire lawyers because lawyers are personal to them, and they ought to know that these advertisements are by people who are not going to represent them, but are in fact going to move their case on down the line to someone else. So we think that's also a critical aspect of this bill, is tell up front, and I will mention, by the way, loan mortgage brokers have to tell you by federal law, they have to tell you, we're not going to service your loan. We're not actually your lender. We're going to send you down the line to someone else. Federal law requires it. It's a similar concept. Why don't lawyers have to tell you? It's even more important, I think, with lawyers to know that this person you're seeing on television is not going to represent you one day, ever. They're going to farm you out to someone else. It's sensible legislation to say that you should indicate that this is an advertisement. You should indicate whether or not you're going to represent the client. And those are sensible rules for lawyer advertising. Lawyer advertising is commercial speech. It is regulatable. The regulations are subject to some constitutional scrutiny, but it's not that we must keep our hands off of it. The idea that the State Bar of Texas can regulate in this area and be sufficient is just plainly untrue. You were told by a couple of witnesses, well, the State Bar already requires you to say this is an advertisement. The State Bar already requires disclaimers. Could you all tell that from those ads you saw? Those ads are running in Texas today. If the State Bar of Texas is doing that in such a great job, then those ads right there today would look different than they do. But they don't. They look just like you saw them. So the State Bar of Texas regulation is not good enough. Plainly, it is not good enough. Secondarily, the State Bar of Texas can't regulate out-of-state lawyers, and they don't regulate non-lawyers. So when the harvester is a non-lawyer, which happens, from out of state, the Attorney General can make them come to Texas and defend themselves because they're making money off Texans. So the Attorney General can do that. The State Bar can't touch them. The State Bar can't touch lawyers from other states that are advertising in Texas, and they are doing it all the time. Out-of-state lawyers, not subject to State Bar regulation. So the idea that State Bar can fix this problem is just simply incorrect. It requires your action from the legislative point of view and some authority to your statewide elected official, the Attorney General, and to local prosecuting attorneys to do something about it. So when I heard earlier, and I wrote it down, the bar does a good job. Well, they may, I guess, but the advertisements you saw before you today are running today in Texas, and those are frightening people into stopping taking their drugs. They are not telling people that they're just harvesting their case to farm them out to somebody else, and those are disclaimers that consumers in Texas are entitled to know. So our position is that this is a good piece of legislation, a very good piece of legislation, not just good, but necessary. It is important legislation, and we would encourage the committee to pass it.
Thank you, Mr. Parsley.